amidst the pandemic.
Life and health, the core values of humanity. For hundreds of years, the median life expectancy was lower than 35.
For centuries,
the reason?
the average life expectancy
Unsanitary
did
conditions.
32 years due to
Эпидемии чумы, или как ее называли «черная смерть», эпидемии оспы, холеры, тифа и гриппа были постоянной угрозой существования городов и целых стран. Только после промышленной революции человечество начало по-настоящему...
Following the Industrial Revolution, humanity began overcoming disease using vaccines and antibiotics. As a result, quality of life improved thanks to the modernization and development of medicine. The 21st century saw significant progress in defeating infectious diseases, allowing modern urban development to shift its focus to creating comfortable spaces for recreation and communication. However, the COVID-19 outbreak reminded humanity that the risk of global pandemics has not disappeared. Under new threats, megacities adapted with the understanding that major changes were necessary. Public spaces were converted into temporary medical centers, and new hospitals were constructed. Medical materials and medicines were transported to regions with high infection risk. Work, school, socialization, and leisure were all moved online. The pandemic, lockdowns, and other consequences reminded us of our priorities. Thus, cities were once again presented with the challenge of keeping their citizens safe. Urban health was born, not just as a concept of urban planning, but a way to care for and express gratitude for each citizen. 80% of a citizen's health is determined by the socio-economic development of their environment, such as living conditions, social climate, and quality of life. Therefore, the well-being of residents must be the central goal of all urban transformation. COVID-19 showed us how connected the modern world is. Matters of health should always be at the center of attention. They require constant monitoring, new management decisions, and new ways of thinking. Welcome to the Moscow Urban Forum's Second International Urban Health Congress, a conference on human health in the city.
Panels of the plenary session, Cities Against COVID-19, Effective Solutions Amidst the Pandemic. We would like to invite up to this stage the head of the Federal Service for Supervision of Consumer Rights Protection and Human Welfare, Chief State Sanitary Doctor of the Russian Federation, Anna Popova. Deputy Head of the Mayor of Moscow in the Moscow government on the issues of social development, Anastasia Rakova. President and founder of the International Community for Urban Health, David Vlachov. And joining us online today, we would like to invite the General Secretary of the Médecins Sans Frontières, Christopher Lockyer. And the moderator of this plenary session, the Senior Vice President of the Skolkovo Foundation, Kirill Kayem. Good morning, everyone. My name is Kirill Kayem, and I'm the Senior Vice President of the Skolkovo Foundation for Innovations. And I would like to welcome everyone here at this Second International Forum. Cities Against COVID is the name of our session, and we'll be speaking about efficient solutions to counter the pandemic. In this intro video, you've seen these awful pandemics which mankind have been experiencing for centuries, and it came as a total surprise in 2019, this pandemic which has totally changed our lifestyles and completely changed the population's behaviors and those great initiatives which we've had in urbanism and when we're trying to take good care of the public health, we have to change those systems, and we would like to discuss those new measures and new capabilities which cities have right now as they are counter and fighting the pandemic. We would like to evaluate the trends and to see what will be the effect of these trends on our future protection and trying to shield ourselves from the potential risks due to possible new pandemics. And as a part of sharing best practices. I would like to invite Anastasia Rakova to share with us of how Moscow is working in this situation and what are the future plans about this epidemiological situation. Please.
Сегодня мы проводим
Well, today it's the 10th Urban Forum. We're holding the forum in this kind of format and situation we could not even imagine some 2 years ago. We are wearing masks, we are having sanitizers, and we keep social distancing. We have half-empty auditoriums, something which would be unthinkable a couple of years ago. Back in 2019, we had been discussing the issues of public health care at the forum. We've been speaking about many things, about the stress and ecology, transportation, about the need to popularize healthy lifestyles and fighting cancer diseases and cardiovascular diseases. But I do not recall that even for once we would mention the virus, pandemics and infectious diseases. Yes, of course, this has always been one of the topics for discussion. However, it was not the top of the agenda of the experts. And indeed, in 2019, we've been saying that we were building new digital medical healthcare, not because we were so insightful, simply the older infrastructure for the classic infectious diseases was outdated, and in 2020 everything has changed. In the matter of months, this pandemic covered the whole world, and again the main vector of attack was absorbed by the megapolis, and Moscow was not an exception. It is Moscow which had to deal with a big blow of the pandemic in our country. As of today, we have official numbers. Over 10% of the residents of Moscow have been through the COVID, and Muscovites are about 25% of the total population which had the coronavirus. If we look at those populations and cohorts which have the symptom-free disease, we have to multiply this time by the factor of 3 or 4. We in many other cities have been dealing with the pandemic, but I say this is not quite correct to say so, because pandemic is not a big blow. It's an ongoing stress which we have been enduring for about a year and a half. Yes, sometimes the pressure is stronger, sometimes it is weaker, but the impact of the pandemic we have been feeling for about a couple of years. And in this slide we can see what we have been throughout these 1.5 years. The very first stage, it was the spring of the last year. We've had a totally new virus and exponential growth of the cases of disease and lack of the capacities, medical capacities, and lack of the knowledge and experience from the medical personnel. And the only right option to keep lives was the lockdown, and such a decision had been adopted in Moscow. Basically, for a month and a half, Moscow had been isolated and closed down, and all possible movements have been drastically limited. It provides very quick, however very expensive result. Back in the spring, we had seen the decrease of the number of cases. The city was returning to the normal life, but still we understood that the virus was to be back, so we were making a huge efforts to identify the new technologies and build new structures for the public health care, and also to get ready for the next ever more difficult stage, which was long in waiting. And since September, we've seen the increase of the incidence of diseases, which lasted for 4 months. It was not a simple period of time, but we did not impose any additional lockdowns. The city had been living with minimal limitations. It was the normal day-to-day activities and life. And we had been hoping that this trend, which we had felt back in February, those peaks in the cases will be something to look up into the future. We had been believing that this vaccination would enable us, in view of these trends, to overcome the virus once and for all. And like we are aware right now, this dream was not realistic. However, the world was very, very close, and Huge multitudes of people in transportation are moving about around the world, and this is happening when, at the same time, throughout the globe, we have hundreds and millions of people having COVID-19. Hundreds and millions of people have been vaccinated, they have immunity, and the huge number of people have never dealt with the virus yet. All of this creates very favorable environment for mutations of the virus and the spread of the virus all over the globe. And since the month of June, we are all becoming the witnesses, because we are witnessing yet another big outbreak of the disease of the coronavirus here in Moscow. And the reason being, it's not just one reason, but the whole set of reasons, but the one dominating reason is the new strain of the virus. It's an Indian strain, so-called Delta strain. And we feel a huge pressure, and the city and the whole managerial team is being pressured, especially the medical wing. Everybody's worn out by this situation. But I would like to say to you confidently that Moscow is managing with this situation, and I'm really hoping that we're doing even better than many other big metropolises of the world. I would like to emphasize once again that despite the situation is being very severe, the city continues to live and operate in a normal lifestyle with some minimal restrictions, which is not very often. You cannot see it very often elsewhere. How come we're dealing with this situation so well, and why things are under control, and what we're doing for that? Well, first of all, this would be the managerial system, which in the last 10 years has been built by our mayor, Sergei Semyonovich Sobyanin. In the matter of weeks, all areas of the urban economy, after his direct command and direct impact by the mayor, have been able to reconfigure themselves, and they began serving the COVID, so to speak. Or no healthcare system of the city of Moscow would be able to do it on its own unless all services would be plugged in and connected to this issue, and like builders were able to erect new big hospital and had provided all the amenities and all the necessary things to it. The public utilities sector have been working with the medical personnel, and they've been providing the oxygen pipes and different units and Bagrov, units which we had been using, and the transportation industry of Moscow on the very first demand would provide us the transportation and vehicles. It was quite an unprecedented. Like today we need 300 vehicles, and then 1,000 vehicles, and then 500 vehicles. We've never heard no from them. And even the sector of services, you would think what it has to do with it. But it is very important for doctors to know that every day they'll be provided with a good catering, good food. It boosts the morale. And once again, I would like to thank the federal levels of authority, federal governmental agencies. We've seen that all the decisions have been made in favor. All of our initiatives would be immediately supported and endorsed on the federal level. I think never before, prior to that, would make such a big, serious decision on the level of the city and the country, not in the matter of days, but in the matter of hours. The second important factor was the well-developed medical system, public healthcare system of the city of Moscow. Moscow, unlike many other mega cities of the world, has much more accessible medical services. And plus, in later years, we have seen very big overhaul and infrastructure change, enabling us to build multi-profile inpatient hospitals and outpatient centers, which would be able to deal with this kind of onset of the COVID-19 pandemic. It is not enough to have certain capacities. These capacities should be fitted with a high-class and high-level medical equipment, and it would be very difficult to do during the pandemic. And this whole work to equip the medical facilities with the top-notch equipment, it should be systemic work. It should be streamlined, not like you do it in emergency situation, like in the last day they bring up some kind of a CT unit and nobody knows what to do with it. All of this had been done in Moscow even before the pandemic. But however strong and robust medical services you have, it doesn't matter how many beds you have in the hospitals, to deal with this kind of big wave of the pandemic without right management, without very flexible approach, without the right routing and sorting, this would be impossible even for such a big city as Moscow. And had we not been planning all these volumes and distribute the workload between the inpatient, outpatient facilities, had we not been relieving the doctors from doing unnecessary administrative workloads, would not be able to deal with this situation. And in the very beginning of the pandemic, like I've mentioned, it's thanks to efforts of the Anna, who is here with us today, we were able to build a unified laboratory service all across the city of Moscow, meaning all the organization, doesn't matter whether the municipal, urban, or some one-off clinic or laboratory, they had to accept the PCR tests and the COVID tests and provide the results to the unified citywide database. And this was the first key of success, because throughout this 1.5 years, every day in the 8 a.m. in the morning, we have the unified database, and we get all the information of the people who contracted the virus the day before. Name by name, there are no doctors, only administrators, but they get the full information, real-time information. They call to people, letting people know that you have the virus and you you have to leave your premises, your facilities. And so we optimize the work of the ambulance, and they are sorting out this list, and they know where we should send the ambulance and who can go to the nearby hospital and who do not need the medical assistance, because we have a lot of symptom-free patients. But we cannot leave people one-on-one with their fears. We have to provide them the support, including psychological support and medical support, because today this person may be without symptoms, and tomorrow they may have the very first symptoms, and we should not miss this very narrow window. And if we give it all to the medical personnel, this would be very irrational use of resources when the resources are limited. So we have the special administrative center of the Moscow multifunctional centers. They're using special checklists, and they are working on that. On a daily basis, they would contact the patients, would ask how they were doing, and with any slightest indicators that people are moving into the active stage of the illness, they would immediately pass on the information about such patients into nearby hospitals. And to be able to organize this kind of system would be impossible if by the first onset of the pandemic we would not have the fully deployed the unified information medical system, or a platform. We can call it different names, but in this platform today, we have the overwhelming majority of the doctors working with this platform, and all Muscovites, they have their own electronic medical record. And having these kind of platforms where we identify all the actions and all the stages, we were able to identify all the patients and to provide them support throughout the whole stages of the illness, and to provide just the right medical assistance that people may be needing in each moment of time. The next important aspect would be the laboratory services, like I've mentioned about this before, and I would like to elaborate. We would never be able to deploy such a big and strong system of medical testings unless lab service would be ready for it. As soon as the Russian regions were able to do their own medical testing, so we have increased the capacity of the testings up to tens and thousands of capabilities. And this was able because we had reorganized the service. We built the competence centers, which had the right staff in them. You can buy the equipment, but you cannot quickly prepare the personnel. And thanks to that, since the spring of 2020, we have been able to do the PCR tests to all the patients, not to lose the infections, not to oversee, but also we do this PCR tests, and we've been doing the PCR tests to anybody, irrespectively whether people were sick or they just want to double check and make sure that they're fine. Again, most of the patients have been treated in Moscow and in their homes, and this was quite a risky step which we had undertaken in the spring of 2020, but we simply did not have a choice. On the other hand, to be able to assign the public medical services this kind of volume of working with patients, it would simply be impossible. And to make sure that we provide the high quality in-home treatment of patients, we had to build a very important tool, the so-called KT or CT centers, and this would be our know-how, which was deployed on the country-wide level. We have built the full-scale diagnostic centers with the full scale and scope of the tools and laboratory diagnostic measures. And these KT centers are working 24/7, and basically they have become the backbone or the backbone of system in terms of routing our patients. And they have increased this outpatient level. They do not need to see the patients. They make a decision who can stay at home, who needs immediately to be taken to the hospital. And those people who are staying at home, they provide the full scale of these medicines, and then transfer the data to the laboratories. And also the local outpatient hospitals are overseeing thousands and thousands of the new identified cases. And in assistance to them, we have built the telemedicine centers, which are working 24/7, along with those outpatient hospitals, and with them also supervising the patients with the coronavirus infection. They have more time to talk to patients and to help provide them psychological support, provide some new corrections in therapy, and then to make some changes in terms of changing the tactics of the treatment. And this also made our medical services stronger. Another thing, we have made a decision in the spring of 2020 that everyone who was identified as a patient, due to the Moscow budget, we decided to provide all the medicines, the whole range of medicines, beginning with the antivirus, anticoagulants, and antibiotics. I guess everybody's knowing these terms right now, and it's something which prevents the blood clots. And if people with the lung diseases, they have the disease in the lighter stage, sometimes we had the patients with the second stage and they had to stay home, we would provide them the pulse meters, so we would help us to oversee these patients remotely. And we have issued over 100,000 of such pulse oximeters, is the name of the machine. And again, our ambulances, even in pre-pandemic time, during the pandemic time, in the post-pandemic time, will be the not only the fast service but also the most efficient service. We gave them a huge workload because they would see patients to these KT centers, even though it is not their direct responsibility. They're providing medicines in very short periods of time. They are taking tests, and even for those patients who are saying, no, I'm not going to the hospital, and we know that in this case we need to take the patient to the hospital, they are providing injections and organizing basically like an in-home care, and thank them for that a lot. And also, not only for us, but all for the other cities of the world, a big challenge was the absence of the enough beds in the anti-infection hospitals to fight the pandemic, because we've seen the big increase. Nobody could foresee such a big demand for such a number of beds, and decisions were different to either to rearrange certain capacities and providing additional beds from the other medical services, or to provide some temporary hospitals. We've tried all of these strategies, and at the very first stage we did not have any other choice. We won't be able to provide enough spare capacity for such a limited time. Or actually, I'm probably wrong, we would be able to create it. I know that our colleagues would be able to provide this temporary number of beds, but I guess our healthcare would not be able in the matter of days to to identify and to dedicate thousands and thousands of doctors. So we decided to change the profile of the inpatient hospitals. When the first wave of the pandemic came down, we began to build the spare capacity, because it enables us to fight the pandemic and sometimes to provide more capacity in terms of the number of beds, or to decrease this capacity depending on the activity of the virus. And on the other hand, we begin to build this kind of spare hospitals, trying to think through that all the systems and like logistics and providing medical equipment and identifying the size of these facilities and ventilations. We provided everything, and all the way to the services, which are very important for people when they are sick, especially because people have sometimes to be in hospitals which may have up to 1,500 patients in one hospital. We have built these kind of temporary hospitals in the spring, in the autumn. We were dealing with the capacities of these specially prepared hospitals, and now that we got this kind of explosive growth of the COVID cases, these capacities are not enough, and for a short period of time, hopefully for a short period of time, again we are engaging other hospitals to fight with the coronavirus. We know that in the summertime we have the less demand for medical services, and as soon as the virus will be overcome, we will return these hospitals into the normal mode of operation. But we will keep these additional capacities, which will enable us to deal with any potential outbreaks of the disease. I guess I've been dedicating this conversation, this talk, to the medicine. I also would like to mention about some other areas which are no less important. In all major megacities, we have a lot of children, and these children attend public schools, and they cannot stay without education for long. Should the virus be of protracted nature, I guess we can keep the kids at home for 1 or 2 weeks, but you cannot leave them without socialization and education for a couple of years. And every city would find their own solution. And of course, the whole previous year of 2020, most of our school-age children were learning in a remote format. The same was the case in many other cities. What is important is how each particular city would organize this kind of distance learning, distance education. And because we had the Moscow Electronic School project, which had been developing very proactively, even before the pandemic, we were able very quickly to use this tool and to build in the video conferencing as one way of education, so we could minimize the costs on the side of the students and teachers and schools. We were able to migrate to the online learning with over 9 million classes. And I think most of you have seen this system. You've seen how it is working. You've seen the very simple button. You can push this button and you move into your online class. And this kind of system, which had been connecting hundreds of thousands of children, it's been working. At first we had some malfunctions, and then it was okay. But some people were saying, hey, you want to move to this kind of online learning, you're doing this on purpose. This would not be possible. We did not have it as a kind of pre-planned strategy. And as soon as epidemiological situation enabled it, we returned kids to their brick-and-mortar offline schools. And actually, for half of the year, kids were attending the school. The pandemic is still here, in this kind of IT technologies enabled those kids which could not attend their offline schools not to quit studying for a couple of weeks when the quarantine was imposed. And for all the 2 weeks of the lockdown, they had been studying at home. You may ask me, how many classes did they have during the quarantine? And I'll tell you that throughout the whole pandemic, during the lockdown, we had over 70% of the whole school population. And in certain moments of time, in each second class, we had like one sick child, and the whole class would be sent back home. And well, previously they were just staying home, and now they were still learning online. And this tool will stay with us for the future in case we'll have some future incidences. Next would be the Moscow transportation, Moscow transit systems. I guess all the doctors would agree with me that this would be the main hotspot of the incidence of diseases, the outbreaks of the diseases, and this is the case. Because many cities of the world would totally shut down their bus transportation, their rail transportation systems. But if you stop the subway, that means that the city will not be functional, because we have a lot of organizations and structures which cannot stop their daily operations. We simply could not shut down the Moscow metro system. So the Moscow decided to, by the decision of the mayor, we decided to pursue the different strategy. We have decided to increase the capacity of the rolling stock of the Moscow transportation systems. On the one hand, we've done that. On the other hand, we had attempted to decrease the number of passengers using the mass transit systems, because we imposed 35% of the people working remotely. Sometimes we would block the transportation card of the retiree population. It was a difficult decision, but we were able to decrease the amount of people using the public transportation and decrease the risks of contracting the disease. Sure, you have to wear masks. It was and is mandatory, and we do everything we can so that people would be wearing masks not only when they are in the subway, but when they're actually riding the tram or the subway. Another difficult choice we had to make, speaking about the economic department, is who we should help and who we should not help. And we had been guided by the federal guidelines, and we have focused on those fields which were hit hard by the pandemic. This would be the services and industries, recreation and culture facilities, and I think that those companies have been provided some deferral in paying taxes, subsidized rental rates, the governmental orders, and as a result, we were able to help to over 57,000 organizations and companies, meaning that this is the 10% of the total working population in the city of Moscow. And we have tried to keep all the development programs intact. And we would stop some constructions, so the subway system or the hospitals, for the matter of days, not weeks, or the capital repair and overhaul. And it may be a paradox, but in the second half of 2020, we were able to finalize the mass procurements to upgrade medical equipments. We bought over 4,000 units of the big medical equipment for the life cycle contracts. When you impose such huge limitations and restrictions in a city, usually citizens and residents of the city, they split into two uneven groups of cohorts. The group number one would be people who understand the danger, people who know that these limitations are forced, and they conscientiously stick to these limitations. The second group of people, this is the smaller group, people who do not recognize this danger, and they demonstratively even violate these rules. And so this smaller group of people may actually nullify all of your efforts and offset all of your good things that you're trying to do of ours and our colleagues from the Rospotrebnadzor agency. But sometimes we have to introduce some measures of responsibilities and do some control systems which we did not use before. And we and our colleagues from the Russian Consumer Well-being Watchdogs we spent many sleepless nights and days to be able to build this kind of control or supervision systems and to make them fully digital. And I guess all the residents of Moscow, they know well the terms such as social monitoring systems, digital passes, and the QR codes, and so on. These type of systems sometimes evoke some negative emotional response, but unfortunately we do not have any other ways to deal with these kind of responses, and it's choosing between the good and evil. Unless we impose these measures, we have to impose the lockdown, which would be much more painful for the city and each of us. But we're seeing that due to the social monitoring system, the number of people who had been in isolation simply because they were sick, officially sick, and they were violating this kind of a lockdown, had decreased by the factor of 8, and that means that we've saved, I think thousands, if not tens of thousands of lives. And the new challenge is the mass scale vaccination. All the epidemiologists and doctors are saying that this is the only true way to ensure the recovery and prevent this kind of outbreaks of the disease is vaccinations of the overwhelming majority of the city dwellers, like 60+% in the very short period of time, meaning that millions and millions of Muscovites have to be vaccinated in the matter of months, not years. And today, again, the whole system of city management is building vaccination points to make sure that as many residents as possible would be able to take advantage and to protect themselves from the coronavirus. And hopefully, sooner or later, I'm fully confident that the pandemic will go down, will be overcome, and this experience will stay with us forever and will help us in the next periods to be able to overcome similar threats. Thank you for your attention.
Thank you, Ms. Rakova. And I'm telling you thank you not for your report, but because I had COVID-19 myself, and I know firsthand how your system worked effectively. The very next day, I got an appointment with the doctor. They called me after my test showed up positive, and the whole system worked seamlessly. Me and my family, we received medical assistance in a very timely fashion. And you're right, the federal government played its part. So I turn to Anna Popova now, head of the Consumer Rights Protection Agency, the chief sanitary doctor of Russia. Anna. Thank you. Good morning. I'm happy to welcome all of you. Right away, I would like to thank Anastasia and Mayor Sobyanin for organizing this event. Thank you for choosing this subject. I don't exaggerate when I say that you really saved Moscow. Let's give a round of applause to Mayor Sobyanin for what he did. I think this was extremely important. This is the second time we have the Urban Health Forum. The first time we talked about social protection in a big city, healthcare, infectious diseases, but that's different. We have been saying for years that we need new regulation, maybe another kind of regulation for bigger cities. What happened over the last century? The risks changed dramatically. You can see those risks here on this slide. I'm not going to go all of them in detail. I'll just mention one. Man-made factors. And this slide is at least 3 years old, so we've been talking about this for a very long time. Once a virus gets into an urban environment where you have a high concentration of people, and the way an epidemic works is the virus gets transferred from one person to another. There are different ways it can be passed, but anyway, the difference is huge. 100 years ago, people would live in villages, and they would only meet maybe 1,000 different people in the course of their entire life. But today, if you go to the subway during the rush hour, you will encounter up to several thousand people. So it's very easy for the infection to spread under such conditions. It all started in Wuhan. So this is the airport of Wuhan. We made an estimate right away in January 2020. And we anticipated certain risks, and it all happened as we expected. You see those countries, those hotspots that have direct communication with Wuhan. As soon as we shut down our border with China, this is what happened. We were able to contain the spread of the virus somewhat initially. But we know that the virus spreads with the same velocity as the airplane travels around the globe. And just like Ms. Rakova said a minute ago, this is our estimate for 2017. You have 170 million people a day traveling by metro. And of course, we did a lot. The federal government played its part. The president got involved from the very first day. And then we set up a task force. And Mr. Sobyanin was appointed head of the working group under the State Council of Russia. All the level of governments, and actually all the people of Russia, all the NGOs, everybody got involved. And because of that, we were able to cope with the situation. You see this chart. It's not our chart. It's not us who made it. You see the attribution at the bottom of the screen. It's Johns Hopkins University. So you can see the curve that represents Russia and other curves which represent other countries. This is the diagram that gives you numbers per 1 million residents. Of course, you can't compare the Czech Republic, a small country, with the Russian Federation, with its population of 140 million people. So, what you see here, what happened to Russia is because of our efforts. It's because of what we did. Now, let's take a look at the urban factor, how it affected the COVID-19 situation. First of all, take a look at the charts representing the situation in Moscow, in St. Petersburg. This is a very vivid example of how the epidemic spreads depending on the density of the population. And we should definitely take this into account as we make plans for the future. This chart shows you intensity in various capitals around the world compared to their population. Of course, we need to study these numbers in more detail. But we all know that Russia is a large country, and the density of population varies greatly. We have Moscow, we have St. Petersburg, we have some other major cities, and they were hit the hardest by the coronavirus. Various megacities try different approaches around the world. You see London, Stockholm, Madrid. In Stockholm, they had no lockdown at all. You see Singapore, they suspended all their activities for 83 days. And then there is Moscow. We had the lockdown, we introduced the lockdown at the right point in time, and we were able to reduce the number of cases all the way until September. You can see on these charts that several capitals had several waves of the epidemic regardless of the lockdown. So anyway, we were able to slow down the process, to control the curve. Of course, nobody can have absolute control. It's just impossible. When you deal with a new infection in the early stages, it's impossible. Nobody has done that. We would love to be able to do that, but it's impossible. Our primary objective was to slow down this process, flatten the curve, and find the proper compromise between shutting the economy down and controlling the epidemiological situation. And I'm really grateful to the Moscow government for what they did. We issued over 50 regulations. This slide says 59. Actually, there were more than that for various industries, various sectors, describing how this infection works, how to control it. We had to set up a proper algorithm for people to follow that would help them stay safe. Some factories continued working even during the lockdown. They just followed the rules, they just followed the guidelines, and thus they were able to continue their operations without getting a large number of cases. The economy kept on running without creating additional risks for people's health. You just need to have proper knowledge. You need to know how the virus works, how it spreads, and what needs to be done to stop it. You need PPEs. You need to control social contacts. You need to have strict rules for public transport. So, like I said, all the branches of government worked together effectively, and we were able to resolve this problem. Of course, we face a new reality today. Like I said, big cities were on the front line. They were hit by the virus the hardest. And this required new skills, new knowledge. But there is one more factor which we did not appreciate enough as we prepared, something that we did not expect. Infodemics, a lot of pseudo-scientific publications, fake news. Because of that, there is a lot of mistrust. Some people don't trust the government, its preventive measures. So what we need to do is learn new communication skills, ensure openness and transparency. Despite all these fake news, there is this virus video. People all turned into virologists these days. Every person has an opinion on the issue. But, of course, they're not professionals. Their opinion may be harmful. And they influence other people. So this is something that we definitely have to do now. We'll have to adopt new response formats. The President has instructed us to create what he calls a sanitary shield. He mentioned this in his latest State of the Nation address. And here on this slide, you see the list of measures that we plan to implement for the future. When we face a new virus, we want to protect the population of Russia while keeping our economy running without a lockdown. Now, let me say a few more words about Moscow. I think Moscow set a very good example of resolving issues in a very timely fashion, promptly, when facing a new challenge. When we face a new challenge, something that we're not familiar with, what's the key thing? Not to panic. Epidemiologists were at a loss. They didn't know what to do. But the key thing is not to panic, to remain constructive, to continue caring for people. That's extremely important. And that's what we did. And of course, it's very obvious, as megacities develop, you have to consider and review sanitary requirements from time to time. You have to create models. You have to anticipate things, make plans for the future. We need to review our regulation, considering the special situation we have in bigger cities, megacities, cities with over 1 million population, cities where density is very high. And this is certainly not the last pandemic. We need to be prepared for challenges like that. This is our top priority today. So we are going to develop a special mechanism for that, and I'm pretty certain that we will be able to protect our people. Anyway, today we are in Moscow, and I want to commend Moscow for what the city did. We do not appreciate enough what Moscow did. Moscow's experience is extremely important. We should learn from Moscow's experience. Thank you very much. Thank you very much, Anna. Okay, you mentioned Moscow's experience, and I talked about my personal experience. It's very obvious today that your agency and Moscow have to aim for herd immunity. So either you have to have had COVID-19 or you have to be vaccinated. And we have all kinds of dissidents. First we had COVID dissidents, and now we have anti-vaxxers, and still we have a large number of people who have been vaccinated. And even though I have had COVID-19, I monitored my antibodies, and when my antibodies went down, I got vaccinated. So what is the percentage ratio that we need to reach herd immunity? And my second question, since we have new strains of the virus, it seems like we are playing catch-up. We are developing new vaccines, but the virus keeps mutating, so it's like we're always lagging behind. If you don't mind, let me start with your second question first. It is a new challenge, it's a new virus, and during the first 12 months, from December 2019 through December 2020, all the scientists, all the researchers said this virus did not really mutate. There were just some minor mutations, and they were regarded as insignificant. And now, so this was the situation in 2019, 2020, and then we learned from our British colleagues that there were some major mutations, and eventually this virus learned to mutate. It's a natural attribute of a virus. Viruses mutate. They adapt. So this will continue for a couple more years, according to researchers. And experts have been saying that this would be a seasonal virus. This was before what we saw in June. And Ms. Rakova mentioned that we have 4 people without symptoms per 1 person with symptoms. Our Chinese colleagues say the opposite. It's anyway. We need to reach herd immunity, but there is no fixed number. This will change depending on the mutations of the virus. And this new Delta strain has now affected a large number of countries. Every day we get updates, and we see more and more data coming in. This new strain spread around the world very quickly. It's now more spread than the British strain. The British strain initially replaced the Wuhan strain. Now we have this new Delta strain that has replaced the British strain. And it happens, it's only natural for the virus to do that. Now, on the vaccines, as of today, every new strain is a little stronger than the previous one. The virus changes. It wants to target more and more people. And at the same time, it is still the same old virus. So when researchers develop a vaccine, they take the parts of the virus, they don't mutate as much. That's the basic principle of vaccine development. If there are any changes in that particular part of the virus, that would be a different virus altogether. Anyway, this means we can still use existing vaccines for new strains. So all the vaccines we currently have in Russia, and international scientists tell us that the same applies to vaccines existing in other countries. They still work with the new strain. British researchers tell us these vaccines are effective against the virus in that the effects will not be as powerful. You will not have to be hospitalized. You may get infected, but it will not be severe. So people need to get vaccinated with the vaccines we have today. The last contact we have between the virus and the people, the last opportunity, the virus will have to mutate. The virus does not mutate on its own. It mutates as it is passed from one person to another. That's the way mutation works. So if you allow the virus to pass through many people, you offer the virus more opportunities for mutation. We have to stop it. We need to stop the spread of the virus. We need to stop its mutation. It's extremely important. I need to get vaccinated because I don't want to let the virus into my organism. I don't want to afford it an opportunity to mutate. So get vaccinated today. Get vaccinated with the vaccine that is closest to you, that your doctor would prescribe for you. Don't wait for anything. Don't pick and choose. We have to stop the virus. If we don't do that, we vaccinate people today. If the risk of encountering the virus is high, you get a weak response during the first or the second week. You can still get sick during this time. But the virus will encounter a small number of antibodies. It will learn to deal with them. If you're not protected, if you allow the virus into your body, you help this virus to learn and adapt to our antibodies. We can't do that. So if you got vaccinated right now, you need to stay away from the virus for the time being. Stay safe. One, you need to get vaccinated. Number two, protect yourself against the virus during the first few weeks. Now, you asked me whether we'll see new strains that will require new vaccines. We don't know this at this point, but our researchers who produced the initial vaccine, they have several options they're looking at. And they may be able to produce a new vaccine if necessary. But the vaccine we have at the moment does work with the current strains, especially with the large cities, with agglomerations when virus quickly travels from one person to another. But that's the world we live in. We made it possible for viruses to travel among people very quickly. This means we have to protect ourselves against this reality. And we know how to do that. We have everything we need. We have the guidelines. It's just a matter of following them. I hope I answered your question. You know, I have to ask you something. Everybody wants to know, what do you think about, how do you think the situation will unfold in Russia within the next couple of months? Well, it will all depend on whether we follow the guidelines. If we all get vaccinated, the best way would be for everybody to get vaccinated in one day. That would be perfect. Or within 1 week. If we all get vaccinated, we'll stop the virus very quickly. So that's number one. And number two, it all depends on whether you follow the guidelines. The virus does mutate, but it travels from one person to another the same way as initially. So you need the face mask. You need to protect your nose, your mouth, your hands. Don't get close to other people. Keep social distancing. If we do all that, we will put an end to it very quickly. If we neglect the guidelines, if we ignore them, you know, people, unfortunately, they are no longer afraid. They got used to this idea. They are no longer afraid of the virus. And that's a shame. I talked to some people, you know. They're afraid of not getting a QR code and not being able to go to a restaurant. They're not afraid of getting sick. Yeah. People in Moscow got too comfortable going to nice restaurants. Okay, let me clarify something. People still want to know. We need a number. Let's say all those COVID dissidents have been defeated, and what you're doing is you're explaining the actual situation to people. Let's say all these explanations work. We vaccinate our population. Let's say in July and August we have the herd immunity. Can we? Will the situation improve within the next year, say? Well, based on what we see today, I don't like this word wave. Right now, it only has affected the 10 provinces of Russia that we have an increased number of cases. On the other hand, we have a number of provinces where we were able to reduce the number of new cases. Of course, the density of population is very different there from Moscow. That's why they were able to reduce the number of cases. So it's very clear. But we do have a good number of provinces in Russia where they were able to reduce, and they have a steady decrease in the number of cases. So I hope they just they can keep this trend going. So they should get vaccinated right now, right? Because they can get people vaccinated before. Yeah, exactly, absolutely. They should do that. So it varies from one province to another for a variety of reasons. Different provinces have different situations, but we need to maintain this positive trend. So face masks, clean hands, and vaccination, and social distancing. Thank you very much. Let me go back to Ms. Rakova, our deputy mayor. Early in 2020, you have always been at the front line, but early in 2020, you were pressed from every direction because of the pandemic. I know you were personally involved. You helped set up the task force. You helped mobilize the healthcare system in Moscow. But let's go back to late 2019, early 2020, and let's take a couple of steps back. Let's go back to 2017, 2019. Let's say you knew the pandemic was coming. What would you do differently? What would you do to be better prepared? So what are the lessons that you learned in Moscow after the pandemic hit? Well, that's what I was talking about in my report. The changes that we saw happening in Moscow in our healthcare system and our social system over the last decade really helped us. So I don't really think we had some major shortages or deficit or mistakes that we made. No, I think we were prepared pretty well. And even during the hardest period, our healthcare system continued operation. We all pulled together as a team. Of course, we need to intensify our work. Of course, we need to take advantage of all the advanced technology. We need to put more emphasis on prevention to minimize the spread of the virus. What about the resources, the assets that you have in the healthcare system? It took extraordinary effort to boost the number of the beds and create new beds in hospitals. Would you agree that this is one of the lessons that you learned? Yes, you're right, of course. We definitely need some kind of reserve, a reserve pool of beds, just in case. Of course, under regular circumstances, you don't need as many beds, and they will not be used. But we do need a reserve. So we'll definitely keep some beds in reserve, and we will keep those ready, and if there is a need, we will deploy them. And I have another question. Innovative technology in Moscow's healthcare system, like artificial intelligence, face recognition. You even set up a special center for innovation. Yes. We do have, the silver lining with this pandemic situation is that we expected it would take us much more time to implement AI and innovative solutions in healthcare. We thought it would take years. It will be a very long time. We will have to explain to doctors how these systems work, that these systems are not going to replace them, make them unnecessary. You know, doctors are very conservative people. They don't like all those IT things. And I personally believed it would take us 5 years, but because of the pandemic, we were able to do it very quickly. It's now a routine thing. All the medical institutions in Moscow have this new system for image processing, and we use AI for processing our scans. We have voice recognition systems for doctors, and this allows us to save a lot of time. We have a special system helping doctors with the preliminary diagnosis. We have tens of thousands of doctors using this new system. So this proved very, very effective. This worked really great. And it's really important to introduce these new technologies, these innovations quickly. And of course, I know that developers have various opinions about the situation. But anyway, I think this is a very good tool. It's ready to go. It's just, like I said, the system is quite conservative. This is what developers say. This is what innovation people say. When I talk to doctors, they say something different. They say that these new IT solutions are too raw. They're not ready. They're not what we need exactly. They need to fix, they need to be adapted, and it will take a lot of effort to do so. So who should pay for that? Anyway, so there's this a little bit of contradiction between developers and doctors, and we are somewhere in the middle. So we set up a special center that would help reconcile these two opinions and help adapt existing innovations for doctors' needs, for practical use. And this center started its operation already. Thank you very much. One more question for you. All the people in Muscovites want to know that it's not just about QR codes and being able to go to a restaurant. I want to ask you about the economy. What are the risks of introducing a new lockdown in Moscow? Is it probable? Well, in my entire speech, I tried to convey one message. The lockdown would be the last measure that the Moscow government will use. We will do our best to avoid imposing a lockdown. People hate QR codes. People hate our social monitoring system. We need all that so that we don't have to impose a lockdown. It's not like we are choosing between using QR codes and having no QR codes. We have to choose between QR codes and a lockdown. And I'm really grateful to the government that made a decision to introduce mandatory vaccination for certain areas of business. Right, vaccination. So we will do our best to avoid a lockdown. We will do our best. We'll do everything we can, and I really hope that the people of Moscow support us and help us with that. Please follow the guidelines. So it's up to the people of Moscow whether we'll have a lockdown or not. Thank you very much, Ms. Rakova. I now turn to David Vlahov, who is the president and founder of the International Society for Urban Health. This is a huge problem, and it doesn't just affect the healthcare system. It requires a comprehensive effort to confront the current challenge and future challenges as well, future epidemics. So what should be included in this comprehensive plan? Transport, housing, other things. And Moscow does something like that. So can you share with us this comprehensive preparedness policies?
First of all, I want to say thank you for inviting me into Moscow and to see such a beautiful city and to talk with people doing some really amazing work. It's very, very impressive. I think to start into the topic, I've got one slide that will contain almost all the elements of what I want to share with you. The first thing is really having what we call situational awareness, right? Can we tell that something is going to be happening and be prepared for it? So that's going to require a number of things. Number one is the international scientific collaboration to be able to exchange information that's happening in real time, right? We want to learn from each other new cases that are happening. What do you know now? And to be able to prepare and react quickly. I think the second thing in situational awareness is what we call syndromic surveillance, right? And that is you can have points of information collection. One of the things, for example, in New York that we developed after the anthrax incident, now almost 20 years ago, was to have a system within emergency rooms, within laboratories, within pharmacies, to be able to say, here are some things, symptoms of the flu, for example, that you would report to the health department. And then that way you could begin to see where were areas where it was elevated. And then you could localize to be able to do the interventions. So that's an example. The veterinarians also very much a part of this. So the communication between the scientists, the cooperation of the community health settings and laboratories to be able to have that quick information exchange. Now, the upside is that sounds very good, right? The difficulty is for people to build that into their habit of reporting cases daily, into a system. It's one more thing to do. And so it is something that needs to be part of the planning. One of the issues that was just raised was the introduction of technology, right? The adoption of innovation. And again, that's not something where we say, oh, we have technology, everybody do it and we all have it together, right? We know this. But there are periods of time. You have people that are early adopters, some that take longer, and some people that'll just be resistant overall. And so now the question becomes, how can you make that happen? We know from medical research, for example, there will be 17 years on average between the time a clinical trial is finished and it becomes part of practice, right? So adoption can be very slow. And I think having the Innovation Center to be able to work not just on the innovation, but also on the implementation, right? How is it that we get this into the field, I think is going to be important. The second area that I have here is the critical mass infrastructure and the essential workers. So who are the critical workers? And we've talked about that a little bit, right? The long-haul transportation, the public transportation, the grocery workers, the delivery people. We can say these are beyond what we're talking of the healthcare workers, right? When we think essential workers, that's who we think of. But it's all these other groups as well. And so how is it that we work to make it people who are at high risk, right, in terms of their exposure to people and the virus, while everybody else is staying home, right, and in lockdown. And so what do we need to do to protect these people? That's what we want to know. And one of the things my colleague Robin Gershon and I did a study of the New York subway workers from the beginning of the pandemic and then following them on. And we saw that 90% of the subway and the bus workers were very afraid. 25% of them had reported that they had symptoms or a doctor's diagnosis or a test, right? 130 had died. And so everybody knew who those people were. And so the question becomes is, will you show up to work, right? Or are you so afraid? And what about protecting your family? So these are issues that we need to deal with. Then what are the personal protective equipment needs, right? The mask and so forth. So those are important to set. But it's not just the virus transmission. If you're on public transportation, then you have to tell other people you need to wear masks. And there are other people that may not want to. And so there's a fear of violence against the public transit workers. And that happened in a few episodes, and it spills over onto other people. So we need to have that critical mass structure. Now the rapid needs assessment is next, yes. And for the rapid needs, we really need to be thinking about not just having the healthcare workers and the hospitals set up to be able to do what they're doing, but what are the backups, right? We can say we need more hospital beds. We need, the workers to work extra time to be able to do this, to be prepared. But also, one of the things that we've seen are medical reserve corps, right? And the idea of the medical reserve corps is you have people that have retired, right? And can they be trained and on call to be brought in? There are also the citizen emergency response teams. Can you organize people and train in communities? And I think that's also, another strategy that one can have. We also have to think about what's the death care sector. In other words, if there are many deaths that are happening, are you, got the right staff to be able to do that? How many are you going to need? Being able to have the epidemiologic modeling and projections, that's going to help the planning. The other areas here, the matching needs to available supplies, that's really looking at what is the unification of hospitals and healthcare within a city. So, for example, in New York City, there are 54 hospitals. They're part of a partnership together. And so if supplies are needed one place, staff other, you can make rapid shifts to be able to adjust to that. Addressing mental health, burnout of essential workers. This is a tremendous stress, particularly early in a pandemic, where you don't know how to care for people. And so being able to have mental health services, spiritual care when you see moral injury that happens through the death. And I can't emphasize the idea of being able to have those services in the work environment. There's been quite a bit of conversation here already about economic and social issues with distancing and shutdowns, and so I won't repeat what others have been saying on that. We certainly need to make sure everybody has income to be able to survive and be secure in their housing. So you put all of these elements together, and what I talk here is about intersectoral policy review, and that is from a municipal perspective, being able to get that information to go beyond the epidemiology and to think of what are the different complexities of the people aspects, and that will help with the decision making and then also the communications. And I want to stop here so there's time for questions, but there are a few other things that we can come back to. Thank you.
Спасибо большое.
Thank you very much, David. We're seeing that this is indeed, it's an integrated approach. And speaking about the municipal level and the federal level, they should be involved in that. But all of us are acting amidst limited resources. And this type of external assistance, when you have limited resources, to make sure that we sort of deal with these challenges, it is important. And my next question addressed to Christopher Lockyer, the Secretary General of the Médecins Sans Frontières. I'm sorry for my French. Mr. Lockyer, right now, those people who are working in Doctors Without Borders, they're working in over 45 or even 50 countries, and usually your organization has always been present in the hotspots, in the areas where we have certain incidences, and it looks like the whole globe has become such a place on fire, so to speak. How come that having a certain number of doctors, you distribute these human resources? How do you make your decision? Where should we go first and send our resources first? Thank you. Over to you.
Well, thank you for the introduction. Thank you for the invitation, and don't worry, my French is not much better. So just a bit of a introduction of MSF and the response that we've been doing. I mean, like with the rest of the world, and it's been mentioned here a couple of times, the pandemic took us by surprise. We were, as you say, and I guess in some ways, looking at it a little bit fortunate over recent years. We do have quite a lot of experience in terms of emergency response, often in very resource-poor settings, but also epidemic response as well. So what we had to do essentially was to set some global priorities for ourselves, and you see those listed here. In English, I'm afraid. The first was that we wanted to keep essential medical services running, so keep going what we had and that was life-saving as a first priority, but also then looking at individuals and protecting those who are most vulnerable at risk, largely around where we already had programs, but not exclusively. And then thirdly, looking at how we could support authorities to provide care for COVID-19 patients in local areas. We have a great deal of experience of working in very remote, often rural, often resource-poor settings, but what we have witnessed, and we've heard it through a lot of the other presenters as well, is that several advanced healthcare systems have been extremely negatively impacted with the pandemics. This is in countries that do have a social safety net, and in countries which often do have, where people do have access to running water and basic hygiene conditions. But our first concern has always been for those people who are impacted by the virus in areas where there are limited or no healthcare systems. What we've done practically and as a first step is essentially to work initially on infection prevention and control measures to protect staff and patients, to be able to enable us to continue these essential medical activities that were ongoing, and to ensure that the health facilities themselves, crucially to ensure that health facilities themselves are not themselves sources of spreading the virus, so that we can essentially try as much as possible to ensure that health facilities themselves remain safe places. The doors can be open to allow treatment for COVID-19, yes, but also the other ongoing activities that are so crucial for many people in the places that we work. It's not all medical, and this has been mentioned previously, but the impact that the pandemic has had on the global transport and supply infrastructure has been huge. This has impacted how we can respond, but it also has a knock-on effect in terms of everyday activities for us. The babies are still being born, people still need treatment from diseases like HIV and TB, and in many cases these severe knock-on consequences, so what is happening behind the scenes when it comes to COVID-19 responses, has left people with very little or no life-saving assistance. So the knock-on consequences for other medical interventions have been huge as well. But when we look at vulnerable people, what are we talking about? Well, there are many people around the world, often in big cities, in urban settings, that are living in overcrowded settings and on streets, in makeshift camps in some cases, or even just in substandard housing. These vulnerable people often suffer from poor health themselves, and are often excluded from the local healthcare system, if one exists, and they struggle to implement some of the social and physical distancing measures, some of the basic guidelines that we've been talking about. If you're in a very vulnerable situation yourself, can be hard to implement, and therefore some of the most vulnerable people need specific distinct strategies to enable their protection and then treatment in the situation or the context of the COVID-19 pandemic. Here's an example, a very quick example. We have a patient called Seko. He's originally from Gambia. He lives in Paris. And like many other homeless people, he has his own health conditions. He has a skin condition, and his only option has been to visit an MSF mobile clinic in Paris. This is not a fancy thing. This is not. It's very basic. You see it here. It's composed of a doctor, 2 nurses, a logistician that helps things to keep running behind the scenes, and a social worker. We've heard a few times over the last hour or so, the importance of mental health, both from a patient perspective, but also from a staff and a service provider perspective. So even just very simple, basic interventions can help with individuals' access when it comes to the most vulnerable people, particularly in urban settings. As we've also heard, protection of healthcare workers is a key element in this from the very beginning of the pandemic, particularly when PPE and personal protective equipment was very scarce. But still now, putting that within the broader context of developing various tools for treating COVID-19 and responding to the pandemic. One of the messages that we are seeing to be able to support people in their immediate needs, but also in terms of getting this pandemic under control, which we hear is a crucial factor in cities like Moscow, but also in rural areas as well, is that we need to ensure that as tools, as drugs, as vaccines are developed, that we're not profiteering, that companies aren't profiteering from these drugs, and that actually they're being distributed as equitably as possible. We find that the profiteering on vaccines, on tools, on specific equipment for treating COVID-19 is unacceptable. What do we mean by this? Is that we think that these tools should be available for all, for the protection of healthcare workers on the front line, but also to allow proper patient care. We're still in the situation where getting vaccinated is crucially important to end the pandemic, or to help to end the pandemic, one of the key factors in helping the pandemic, along with guidelines such as social and physical distancing. But the availability of vaccines remains scarce in huge areas of the world. We need to have more dose sharing. We need to ensure that we're not just putting money into a system, but actually doses of vaccine, ensuring that we're scaling up the production, and that we're resourcing the delivery of vaccines to people. It's often that last mile, that last step in terms of getting the vaccines into people's arms that is the most resource-intensive bit, and is often missed out in terms of the planning of a vaccination program, particularly in rural settings. There's also a big concern, and we've heard comments in terms of disinformation and concern about vaccines, but vaccine hesitancy and educating people in terms of the benefits of having a vaccine and the risks of not being vaccinated are huge. It applies all around the world, this important topic. And we need to also ensure that when we're talking about risks, particularly when it comes to vaccinations, that we're looking at who is holding the liability there, and we're not pushing the liability and the risk of these vaccines onto the people who are necessarily operationalizing and implementing the vaccines, but keeping them with the manufacturers, which is the norm, which is the case for most vaccines as they pass the qualification stage. That's a very quick rundown of our priorities and our concerns, and again, thank you for having me. It's been a really interesting session that I've been listening into, and back over to you.
Спасибо большое, Кристофер. Анастасия Владимировна, в качестве...
Thank you very much, Christopher. Anastasia, as the way to wrap up the session, could you please say that Moscow is in an ongoing situation where we're trying to collect the best practices from all the big mega metropolises and megapolises to make sure that we contain the infection and have effective counteractive measures. But we have an ongoing analysis, and today we've seen very interesting scenarios about, new policies, and Christopher gave some examples of how MSF is working today. What else? What else may we expect from the government of the city of Moscow in counteracting the virus? Maybe we'll have the in-home vaccinations, and what is your thinking about these issues? Well, we are already doing the in-home vaccinations. I've heard many interesting and very important statements. I fully comply to what David has said, that situational awareness plays a very, very important role today. And we are monitoring the latest publications all over the world on these topics, and it's a big help. And many measures which we are introducing today, we do so because we use the best practices and those best effects which we may have in different regions, and we believe it is very important indeed. And we are going to press forward. And today, the Department of Healthcare has made a decision in view of the fact that the Delta strain, which appears to be dominating in Moscow today, it is much different from its predecessors, so to speak, and as it has been mentioned, it has the shorter incubation period. Only 3 to 5 days is much more contagious, and what's more importantly, we have a change of symptoms of this strain. Basically, it's nearly unidentifiable on its initial stage from just a regular cold, which you may catch in the form of just a light cold and slightly increased temperature in some sore throat. And this kind of early dominating signs which we had previously seen, like the loss of taste and dry cough, we can see these symptoms they have become more rare, which means that we have faster in diagnosis, in isolating those people who may have contracted these strains. So the Department of Healthcare has made a decision that everyone who may have the cold, people with the cold symptoms will be equated to the COVID patients. So we are beginning an experiment in line with which, additionally, if the doctors are visiting such patients who may have the cold or flu symptoms, and when the doctors are visiting them, we'll be doing the so-called express antigen testing, and this to the PCR testing. It takes only 15 to 20 minutes, and this will give us the higher degree of probability in knowing what is the actual disease. If we can find this protein with a high degree of probability, it may indicate that the person is infected with the COVID-19, and of course, this kind of quick express diagnostic will be followed up by the PCR testing, and we'll be able to isolate patients and provide them the faster treatments. We are going to launch this kind of initiative. It's not even experiment; it's quite a serious countermeasure. And as we are finalizing our discussion, I would like to extend my request to the city of Moscow, and on the federal level, I suppose we have to do this. Why we have all this fake news about vaccinations, why the fake news seem to be winning in the world today, because you always have some kind of pseudo-scientific, quasi-scientific explanations, and people reading this supposedly justification, they believe that the risks are very high to get vaccinated whenever they believe this kind of fake news. So if we'll provide this type of communication on a solid scientific basis, we give the real risks, we give the real numbers about of being vaccinated or non-vaccinated, or sometimes even have the certain extreme cases of deaths. So I think those doubters, those people who are sitting on the fence, they will make up their minds and they will go vaccinated. So I believe we need this kind of positive propaganda. Thank you very much, dear colleagues. It was a great discussion indeed, and hopefully these plans and facts and deliberations which we've heard today will help us to do away with the pandemic. Thank you.